related to Japan, but tomorrow it may be a problem for many other countries, including China, in future. And you know why I'm talking about Japan. I just want to be safe in China. Okay, okay, I'm just kidding. Right, so look at the topic title, which is Superaged Japan, meaning the old Japan, where the people are aging very fast. I mean, they're surviving and aging as well. And perspective from the medicine point of view, what's happening to the medical system and what kind of evolution they have to take to keep the medical system surviving and successful. So, next slide please. Alright, so this is the paper I took because the purpose of my speech was to present a paper in an entertaining way. So I'll try my best to do that. There were a few doctors who combined together and wrote this paper. And the topic was Japan as the front runner of the super-aged societies. Because old people are living longer and we don't have kids. I mean, fewer kids. Perspective from medicine and medical care in Japan. There was a big article with that, so if you want I can give it to you later, but that's what we have to focus on right now. So next slide please. Okay, no, next, just keep moving. So now what's happening, see the problem arose because of these two issues. The first one was low fertility rate, like people have less kids and that's one of the problems. Japan fertility rate was per woman, before it was like in 1955 it was around 3 kids by one woman, and later it decreased. 2010 it was decreasing, and this is another chart where you can see it decreased till 2005 and there was an increase. So there were different studies, and but yeah, they were trying to restore the population by increasing the number of kids per woman. Okay. And there is a study which says if you don't have 2 kids, if a woman does not have 2 kids in a society, it can go below the replacement rate. That is, the population won't come back again to earlier thing. Okay, so that's one of the problems, low fertility rate. And the other problem was higher life expectancy. And this is one of the medical success, that people are living longer. That's an achievement of the medicine, right? But this is also creating problem because people are living longer, like 80 or 90, and can you find Japan in the list? This is the one. 84, you know, if you want to live longer, go to Japan. And can you find China in the list? No, you cannot, because it's much behind. It's 101 rank, and the average
74? Under the 74?
No,
it's 75.5.
No, 78.
The ranking is 101.
The latest.
Well, there can be a bit of variation depending on the source. You know, like what kind of source you
Okay,
follow.
okay.
All right. So Japan is the top, and then we have many other countries. All right. This is the organization called OECD, which released this data. Okay. Now, what is the background of this issue? Look what's happening. Current status. 65 years or above in 2030 was 25% of the population was more than 65 years, and that means they were retired. Okay, they're not working. They are not as productive as maybe younger people, and in 2025 it's expected to be 30%, and in 2060 it's going to be 40%, which is like almost half of the whole population. Which means, in a way, that less number of doctors, less number of workers, less number of service providers, because they are all retired age group. Okay? Until unless you develop some regenerative medicine where people start getting younger again. Well, that's far away. 75 years or above in 2013 was 12%, and 27% in 2060. That's the expectation. Now, what is the problem? Another thing is anticipated change in medical care, both qualitatively and quantitatively. So, medical status of Japan is good, but there is anticipation that it may alter a bit, it may go worse, or the resources may decrease. That's the anticipation. Now, depending on that, some discussion was done in this paper. Now, the problems are cure-seeking medical care mentality. So, when you go to the hospital, when you see there is something wrong, my leg is broken, I go to the hospital, okay? I have fever, I go to the hospital. My stomach is paining, I go to the hospital, right? So you need cure and then you come back, that's it. So that's the status, that's the kind of treatment we are following in these days. The second thing is hospital-centered medical care. So you have to go to the hospital. You're lucky if you have doctor in-house, that's a different case, but usually you have to go to the hospital, and which is difficult, which is time-consuming, money-consuming, energy-consuming, and as an old person it will be more difficult. So, and the other one is paradigm shift. The thing they're talking about is really different thing. I mean, it's not something which it's not the healthcare that we have today. The kind of healthcare they're proposing is going to be totally different. Okay, now let's see what they're trying to discuss. Okay, the proposals are, what are the steps that needs to be taken to overcome this problem that we are going to face in the next few years? The first thing is, we have to change the mentality from cure seeking to cure and support. See, what is important? The important thing is not to get my leg fixed. The important thing is that I walk properly. Even if my leg is broken, if I walk properly, I do everyday things, it's okay, right? If my leg is broken and I'm like, trying to fix all the dots, all the fractures and all the small cracks, and there is no change in lifestyle, that's not needed. The main point is I should be able to walk, do my daily things, right? So that is, in a way, cure seeking, that's what we look for these days. We want things to be fixed, but we should be more towards result oriented, like cure and support. We need constant support, which means education, which means regular checkup, which means preventive care, like someone tells you don't do this, this can harm you this way, making it more accessible kind of thing. So, this has a broad meaning, but what it means is you don't get the care only in the hospital. You should be getting it more easily and in a wider way. Okay, the second thing will be, it should be shifted from hospital to community oriented medical care. So you don't have to go to the hospital every time to get checked. It can be done in communities like schools, playgrounds, things like that, making it easily accessible for common things like checking your blood sugar or high blood pressure, and certain diseases, like she talked about depression. You can discuss those things if you have medical staff available in those kind of settings. So the point is to reduce the profit of the hospitals in a way, by making it more accessible to people in the locality.
Yeah.
So making it, bringing it out of the hospital to the community where old people and people who are aging can easily go with less expense of money. They have enough understanding of what's happening to their body and what kind of things they have to take care of. We have pediatric department for kids, for newborns who are recently born. We have special department for that. We don't have geriatric. I know we have in Shekou hospital and some of the hospitals. Don't forget it's Shenzhen. So they have started evolving and they're making this department, geriatric department, which is only for the old people. Because in old people, you have to follow different kind of medical solutions. You cannot go aggressively like you go in younger people, right? Like if an old person have fracture of the hip, for example, you directly don't go for surgery because you look at the risk. Yeah, you do the surgery, what happens after that? The patient may not recover because their body has weakened, the system has weakened, and they may not have enough resource inside the body to heal the surgery. So you have to consider those things. And also they get slowly, as age progresses, they may have dementia, like less memory and less understanding, lack of balance and things like that. So you have to also keep in mind various other things. So that was an example. So geriatric medicine is kind of combined, contribution from different departments where they try to be a bit milder with the treatment with the old people. So this is something which they are trying to promote in various hospitals in Japan. We do have it in various hospitals, but it's not so common. We have to make it common everywhere. Now, one of the most difficult things to do is to put doctors from different backgrounds. They don't like working together. I mean, it's a fact. If you bring a neurologist and an orthopedician together, Because I'll give you an example, like the surgery of the back, you know, this disc surgery belongs to two departments, neurology, neurosurgeons, and also to the orthopedician, the bone specialist. And they can have different opinion on how to approach. So sometimes it gets difficult, but that's one of the challenges that we bring collaboration among different specialities to get a better result in and forming the geriatric center. So, right. So they were trying to. They also suggest, you know, promoting interdisciplinary collaboration and promote geriatric centers. So far they have it in 30% of the hospitals in Japan, only 30%, but they are trying to promote it further because they don't see future so bright in that aspect. Okay, so that was it from my side. If you have any question, you can go further, please. Please ask one question, two questions.
If we don't have nurse, would it be possible that we can use AI?
Well, we can use AI, but the problem is the cost. It's going to be very expensive, and we are at the starting stage of AI. The difference between AI and the nurse and the doctor will be the experience. You need to give a lot of teaching and a lot of perception of the information from outside world to the robot, perhaps, and that will create the experience. Experience is something which will be lacking in the AI in terms of healthcare. So if you're a bright student in a medical college, or if you're a bright surgeon, gold medalist, it doesn't make you a good doctor. You have to have a different kind of thinking and, you know, the thought and the perception to do that, the experience as well. So experience is something which will be missing in AI, but yeah, it can help to some extent.
So according to your experience, what is the biggest reason for in Shenzhen there's no home doctors or yeah?
I think you know, one of the things is see, I try to be honest. One of the problem is the corporate world. You know, they want to make profit, and if they allow everything to happen by themselves, you know, people will lose on the other side.
Okay. Thanks, Dr. Mark, for our so special speech.